Losing a parent is terrible for any child, but children living in developing countries who lose their parents to AIDS face unthinkable hardships. Not only do they have to watch their parents die, but they are stigmatized for having been associated with HIV and AIDS and are often forced to fend for themselves and their siblings. The result is that a growing number of helpless children are facing a cycle of abuse, neglect, stigmatization and disease. On World AIDS Day, News First takes a first-hand look at the impact of the disease.
Just like any other child, Samitha too loves to play, talk and laugh. He too has the same needs and wants of any other child. But Samitha's future does not seem to be the same. Samitha has been diagnosed positive with HIV/AIDS. To make matters worse, his parents died of the disease, leaving him and his 11-year-old brother orphaned.
My sister and her husband contracted the disease. We later found out that Samitha too has got infected. They have had to face many hardships. The parents died and I am looking after the children.
There is currently no known cure for AIDS. Specific damage to the immune system caused by the human immunodeficiency virus or HIV leaves individuals susceptible to opportunistic infections which lead to death. The transmission can come in the form of sexual intercourse, blood transfusion, contaminated hypodermic needles, and exchange between mother and baby during pregnancy, childbirth, or breastfeeding. According to World Health Organization, during 2007, 2.5 million out of a total of 33.2 million HIV-infected patients has been estimated to be children.
Now in Sri Lanka, mother-to-child transmission, so far it is about 26 to 28, the numbers. And we don't know really how many children are infected from mother to child, because most of the time these things are reported when the child is presented first, not the parents. But there may be a lot of children who are infected or affected by HIV. Infected means it's the infection, but affected means they are actually orphans because their parents are infected and they died, and there's nobody to look after children and they are helpless.
Children get infected and affected of no fault of their own. But once a child contracts this deadly disease, there is no turning back. So, is it not unthinkably unjustifiable to stigmatize them and to make what little life left of them agonizing and humiliating?
A lot of people ask me to put them in seclusion. People shut their doors when they see these children on the road. This gives me immense pain.
Eight-year-old Samitha, his 11-year-old brother and their caretakers were cast out from their village. They now live in seclusion. They were subjected to unthinkable psychological trauma, fear and shame that haunt them what would otherwise have been a carefree childhood. Samitha is a beautiful child. He is friendly, and when he smiles, the whole room lights up. What makes their ordeal even worse is the heartless, unforgiving stigma attached. HIV cannot be contracted by being close to, talking to, or by touching a patient, or by being kind or being compassionate towards an HIV-positive patient. We should have a change of heart, especially towards HIV-positive children. If only the adults could act more responsibly, children like Samitha and his brother could be saved.
If we know the pregnant mother is positive, there are ways that we can stop. The thing is, one is now we can give treatment for the mother to prevent that infection going to the child. And sometimes doctors decide to do a cesarean section to stop that HIV transmission during the delivery.
The theme for World AIDS Day 2007 and 2008 is leadership. Let's give leadership to eradicate the stigma attached to the disease. Let's uphold the dignity of those infected with HIV/AIDS, especially innocent children.